Good morning. I'm Delegate Edith Patterson, and I'm proud to serve as the 42nd President of the Women Legislators of Maryland, casually known as the Women's Caucus. I'm honored to welcome you today to our briefing to discuss the priorities. These are priorities we've worked on since the summer retreat, as well as during our various executive board meetings. When we think about the Women's Caucus, our mission has certainly not changed since we began 52 years ago. And our efforts have always been focused on women's issues, as well as not only women's issues, but those of families as well. And with that in mind, I would like to share with you our priorities for this session. We're very honored to have with us the Comptroller of Maryland, who is a former member of the Women's Caucus and will later be recognized and honored by this caucus for her leadership and for the historic role she plays in Maryland's history. Thank you very much. Thank you for being here. Today we will focus on 5 priorities. The first being the Equal Rights Amendment. This amendment was first introduced by our former president, Delegate Leslie Lopez. Equal Rights Amendment. It is a joint resolution that I'm co-sponsoring with Delegate Lopez, and on the Senate side, Senator Ariana Kelly. And this is an amendment that we're seeking to affirm. And therefore, we as Marylanders must have this included in our Constitution, an affirmation statement also sent to the U.S. Congress to make the Equal Rights Amendment the 28th, let's say women, the 28th amendment to the U.S. Constitution. Our second focus is pretty much in line with that of Governor Wes Moore. Senate Bills 451 and Senate Bill 413 addressing family and military issues. Delegate Guile.
Good morning, everyone. I'm Senator Dawn Guile from District 33, very proud to represent District 33 in the Maryland Senate. I'm here today to talk to you about 2 priority bills related to specifically military families and military spouses. Now, military spouses can be both women and men, but 91% of military spouses are women. So a lot of the issues that impact military spouses are a women's issue. As I mentioned before, military spouses are overwhelmingly women, 91%, and face unemployment rates several times higher than the national average. Oftentimes, when they move from state to state, they find themselves at the bottom of daycare waiting lists, and these child care challenges, compounded by the discrimination they encounter in hiring, further exacerbate the problem. Additionally, SB 411 or HB 431, cross-filed by Delegate Pruski, is a bill aimed at renaming the Maryland Department of Veteran Affairs to the Maryland Department of Veteran and Military Families. I was very proud to work with Secretary Woods as well as the administration on this bill. This bill is a small bill in just renaming the department. Overall, reflects the better focus and the mission of the department to not only support veterans, but also recognizing the full sacrifice that military families play, including that of military spouses. I'm also grateful for the support of the women legislators on these bills, so thank you very much. Delegate Patterson, you announce the next.
All right, now we're going to lead into our third priority, which is health care. Senator Carter and Delegate Wyoka North, Delegate Jones, Delegate Pam Queen, and Delegate White-Hollow.
First, I want to thank Delegate Edith Patterson for her leadership, and I want to thank the Women's Caucus for taking consistent, strong, necessary, and courageous stances on behalf of women, children, and families across the state. My specific bill, along with Delegate Marie Q. North, I believe speaks to our civility and our recognition of everyone's humanity. It's a simple bill that simply would provide that women who are incarcerated would have an adequate bonding time with their child. Bonding is essential not just for the mother's mental health, but for the child's mental health. This is not only about the mother and the child, however, this is about who we are as a state. This is about whether or not we are a state that believes in rehabilitation, reintegration, and an opportunity to work toward the best outcomes for children. This is about understanding that even though someone possibly done something wrong, that they are still a mother, they are still human, and they still should have their fundamental rights and their constitutional rights recognized. It's a public safety issue, because when you have mothers and children bonding, you are going to have better outcomes for both. Thank you.
Good morning. I am Delegate Dana Jones. I represent District 30A, which is the city of Annapolis and surrounding Anne Arundel County. I want to thank President Patterson for her leadership and everything that she has done. I'm so appreciative. I'm so proud that my bill, HB 522, Student Telehealth Appointment, is part of the Women's Legislators' 2024 legislative priorities. HB 522 would simply require county boards of education to establish a policy to accommodate public middle and high school students who need access to telehealth services during the school day. The blueprint made clear that mental health and access to care would be a cornerstone of its implementation. Telehealth services support our children emotionally, physically, educationally, and socially. We must remove as many barriers as possible to students who are attempting to receive care, and HB 522 really works to remove those barriers that so many school systems throughout the state or schools are putting in front of our students. So I want to thank all of my colleagues from the Maryland Women's Caucus and the Women's Legislators in order to put forth such an amazing package supporting women, children, and our families. Thank you so very much.
Good morning, I'm Delegate Pam Queen from Montgomery County, Maryland, and I would like to add to this list of health care bills, a bill that is very important to me. As a 14-year breast cancer survivor whose late diagnosis resulted in aggressive treatment, including chemotherapy, a mastectomy, and radiation treatment, I know firsthand the benefits of early breast cancer detection. HB 965 expands the Maryland Department of Health's breast cancer program to enable screening of women under the age of 45 who are considered high risk for breast cancer as diagnosed by the CDC and with prevalence of different races, and to develop and implement a public awareness campaign to encourage individuals to participate in the department's breast cancer program. Because early detection saves lives, passing HB 965 is imperative for all women in Maryland. Thank you.
Good morning, everyone. It is a pleasure to be here, and again, thank our Madam President for her leadership and all of you for being here, and certainly to stand side by side with my fellow women legislators. My name is Delegate Jennifer White Holland. I have the pleasure of representing Legislative District 10 in Baltimore County, and also standing here next to me is Delegate Jamila Woods. And we have the pleasure to be working on maternal health legislation that this caucus has identified to support. Maternal health, again, continues to be an issue that we see in our state where we need to make more progress in. And so we find our greatest disparities, especially when it comes to Black maternal mortality, where Black women are 3 times more likely to die from a pregnancy-related cause than their white counterparts. And it's also mind-boggling to know that many of these deaths, about 80% of these pregnancy-related deaths, are preventable. And so alongside the Legislative Black Caucus and the Women's Caucus is pleased to champion the Maryland Maternal Health Act of 2024 that will update and streamline the utilization of key forms during pregnancy and upon discharge to improve care coordination, making sure that there are the necessary linkages to community-based services. And so this bill will also increase the study and action around severe maternal morbidity, as well as developing an annual report card that is risk-based and balanced on maternal care facilities with key indicators. Delegate Janelle Wilkins and I are pleased to serve as the lead sponsors in the House, and Senator Arthur Ellis has cross-filed this bill in the Senate. And so these bills together, along with others, will improve maternal and child health We know that this is just the beginning, but we recognize that this is a really good step to move forward. Thank you.
And just to add to what Delegate White-Holland said, this remote ultrasound procedures and remote fetal non-stress test gives the opportunity to greatly increase the outcomes for pregnant mothers and their children. With this remote access, we have technology that moves in real time and real communication. A person who cannot get to a doctor, these can go on the ambulances, these can go in medical facilities, or these can be in the home of the mother who cannot get out, who can actually, in real time, the doctor can read exactly what's going on with this child. Sonograms can be connected to an iPhone, to an iPad, to a computer, and we can get emergency care in the moment. Not only that, but the mother can be told in the moment exactly what is going on with her and with the child. And so we are promoting this. My bill is called Maryland Medical Assistance Program. We want medical assistance to pay for it, especially for mothers who are in the poverty stream, have low income. But we want to make sure that these services are available because, again, they will greatly improve the outcomes of mothers in their pregnancy. It's called Maryland Medical Assistance Program, Remote Ultrasound Procedures, and Remote Fetal Non-Stress Tests. And one of my delegates there, I actually have, for those of you who are interested, a picture of both the ultrasound so that you can see what it looks like, as well as the belt that goes around the mother's stomach. And again, the doctor is reading it in real time. Thank you so much.
All right, the fourth priority is gender and discrimination economics. That will be offered by Delegate Robin Lewis and Delegate White-Holland.
My name is Delegate Robin Lewis. I represent District 46 in Baltimore City, and I'm truly honored to serve alongside these brilliant, courageous women leaders in the legislature. Actually gave me chills this morning when I came into this room and saw the brilliance, the glow, the power of this group. And I know that working together, we will prevail to improve the lives, the opportunities, and the contributions of women in our state. One of my bills has been chosen by the Women's Caucus as a 2024 priority. It's an honor. This is the Home Care Worker Rights Act of 2024. That's House Bill 39. This bill addresses a couple of really important challenges that we have. First, it helps to address the home-based healthcare provider workforce shortage. As you guys all know, in the state of Maryland, we do not have enough healthcare workers in all of our cadres. We don't have enough physicians, we don't have enough nurses, we don't have enough radiology techs. But most importantly and most personally, we don't have enough home-based care workers. This cadre of healthcare provider, they're referred to as home care workers. They may be called personal care assistants. They're sometimes referred to as direct care workers, but these are the people who come to your home and assist you when you've been discharged from the hospital after surgery. These are the people who work in the community and assist our family members who may have disabilities or physical challenges to complete the daily activities of life, like bathing and cooking. These are the workers who are in our nursing homes, who are in assisted livings. These are the people who help your granny when she's recovering from surgery or stroke. And you know what is also special about these workers? They are almost entirely women. What else is special about these workers? They're almost entirely women of color. House Bill 39 works by requiring that residential service agencies that wish to use Medicare funds to pay their workers, to pay home care workers, they must categorize those workers as employees. So this is an issue of worker rights. This session, let's give home care the attention it deserves. Let's give these frontline women workers the respect and protections that they've earned. Thank you so much.
Our last priority is one that's really in depth in terms of child care and facilities. I'm going to ask again Delegate McCaskill, Delegate Guyton, and Delegate Mayo from North.
Hello, good morning. I'm going to jump in. Early access to high-quality early childhood care is important to the women legislators of Maryland because it is important to the women and men, but primarily women of Maryland. So I want to thank you, Delegate Patterson, for supporting this initiative and our colleagues. Because it's so important, we have been meeting as a subcommittee on this issue over the past year and have met at least 6 times, maybe more. The bill that we're talking about today really grew from those conversations because at one point we said, wouldn't it be great to have all of these people that we're meeting with separately in the same room? That's what this commission does. That's the only way we're going to be able to solve this problem. So the Commission on Access to High Quality Early Childhood Education and Child Care for Children 3 years old and younger, because the blueprint addresses older children than that, is the bill that I'm introducing today in probably an hour if anyone still wants to sign on. Mostly though, we all are in agreement that we have to protect, as a delegation, as a women's caucus, and as a legislature, funding for child care scholarships in the state of Maryland and for the Career Development Fund for child care workers. So that is also a top priority. Thank you so much. I'm going to turn this over to Delegate McCaskill.
Why, thank you. So in addition, I just want to say thank you as well to this caucus, to the leadership throughout the state of Maryland as well. I am, for the record, Delegate Alethea McCaskill, representing the Fine 44B in Baltimore County. For a little over a year, some of you know me as a legislator, but for the past 26 years, I am an early child care educator. I am here this morning to speak on my bill, LR 2665. This bill's intent is to reestablish how MSDE defines infants and toddlers in both regular family child care homes and large family child care homes. They are 2 distinct differences here in Maryland. Currently, MSDE groups infants and toddlers up to age 2. It will bring good news, I said good news, to families, providers, and to the capital budget. Pre-blueprint, probably for the past 10, 15 years, many folks in the child care industry have been asking for MSD administration to help with changing of some regulations to help adjust ratio and what they consider infants or age under 2. So, I said good news. So families, parents will have the option of keeping their children together as slots open up for expanding families while saving money on tuition. Please keep in mind that in most instances, tuition for infant care is much more expensive than older children. Maryland providers strongly agree that with the impact of the necessary blueprint and the expansion of pre-K 3 and 4 programs, providers will be negatively impacted because slots for the 3 and 4-year-old population will be lost to many local school systems. With the adoption of this legislation, providers have the option to expand their marketing and seize the boundless calls from families in search of childcare for children under 3. Currently, providers are limited to accessing children under the age of 2. And for the state, here's the other good news. This bill will have a positive fiscal impact. Translation, no additional cost to the state. You see, almost immediately, the state will save money through payout adjustments within our child care scholarship program. We know that in child care, and the pandemic has proved it, that child care is a family problem. It is our one of the economic engines, to our backbone to our economic engine, and we know that it affects mostly women, mostly Black and brown women. And so I'm excited to move this legislation and get it to the governor's desk. Thank you.
Good morning, everyone. I'm Delegate Bernice American North, representing District 14, Montgomery County, and I am delighted to speak to you about a bill I introduced last week, H. Bill 377, and also thank Senator King, who's the Senate sponsor, that also had the bill hearing last week. This bill seeks to remove the sunset provision for the therapeutic child care programs that exist in Maryland. Now, for those who don't know what they are programs that are licensed, integrated mental health and education programs for families with high-risk children from 0 to 5, which is why this is falling under our priorities under child care. These children show significant delays in social and emotional development, and many have experienced trauma in their lives. And many, because of that, have been removed from traditional mainstream preschools and daycares due to safety concerns or behavioral issues. Now, therapeutic child care programs also partner with parents and caregivers to effectively support the development of the child and family as a whole. Therapeutic child care programs also offer specialized child care. For example, children who might be experiencing homelessness or housing uncertainty. The $3.7 million that's already allocated is well worth the investment. I've seen it firsthand in Montgomery County, the Lord Center in Rockville. These programs have leaders, teachers, and staff who are dedicated, caring, and attentive to the needs of the children. And success is evidenced when you're able to transition the child into a mainstream kindergarten and maintain their educational placement and social emotional gains through 2nd grade. And luckily we had at least one person testify to show that it's success in our hearing. And this is why this is one of the bills' priority for the Women's Caucus. Now, by investing in these programs now, we're saving money in the long run. So yes, it has a fiscal note, but we're saving money in the long run. We're reducing the need of family services. We're reducing the need of long-term intensive special education. And we're also dealing with the root causes of youth crime, trauma. This is the kind of investment that we need to address the root causes of youth crime. Because even as we face a budget deficit, this funding is going to avoid the costly corrective actions on our youth that we're bound to have in the future. Now, dealing with children from 0 to 5 is a critical point in our lives, as mothers, as children, as communities. That's why these 3 bills, among the support of the Women's Caucus, is so critical, because we know that we take care of our kids at that early stages. We're taking care of our community, we're taking care of Maryland. So I thank Women's Caucus, I thank President Patterson and our team of fabulous, intelligent women representing Maryland to make sure that we're getting these priorities done, not just for Marylanders, but really for our communities and women and families and children as a whole. Thank you.
Thank you very much. Thank you very much. I'd like to thank the committee chairs in various departments. We have Delegate Michelle Guyton from the Legislative Review. We have Delegate Foley and other chairs. This caucus, Women's Caucus, is dynamic. And so I'm very pleased with so many pieces of legislation we will support in the 2024 session. I'm going to acknowledge our Executive Director, Ariana Ward, and my Chief of Staff, Kara Franklin, for the work they've done supporting the Women's Caucus. And I will now turn over to Ariana to find out their questions for the members.